Welcome to the Raigmore Hospital Endoscopy Unit. The aim of this video is to show you around the unit and to give you a better idea of what to expect when you attend the unit. The video is designed to complement the information already given to you in the booklets. Please ensure you read your booklet fully as soon as you receive it. It contains important information about medication and preparation instructions, as well as important aftercare instructions that must be adhered to. The endoscopy unit is situated in Ward 8, next to the maternity unit. Please enter the hospital at the ward's department's entrance and follow the signs for Zone 8. When you arrive at the endoscopy unit, please ring the doorbell and one of our receptionists will check you in. They will ask you for your questionnaire and confirm your details. You will then be asked to take a seat until the nurse is ready for you. Please remember that we have 4 endoscopy rooms running various types of procedures. This means that some people who arrive after you may be taken through before you. We will do our best to inform you of any delays, but please be aware that you may be in the unit for up to 3 hours. Once the admission nurse or endoscopy assistant is ready for you, you will be called through to one of our admission rooms. There, the nurse will go through the paperwork with you, ask you various questions about your medical history, and also ensure you are prepped appropriately for your procedure. They will take your blood pressure, temperature, and heart rate, and insert a cannula if appropriate for your procedure. You will also be asked to sign your consent form, and this will be confirmed and signed by your admitting nurse. If you are having a gastroscopy, you may be asked to have a seat in another waiting area. If you are having a colonoscopy or flexible sigmoidoscopy, you will be taken through to our change and wait area, where you will be given modesty shorts and gowns to get changed into. You will be given a bag to place your clothes and other belongings into, and this will be kept with you at all times. You will be shown where to wait here until it is your turn to go through. You may be waiting here for a while, so feel free to bring in your own reading material to pass the time. Once the endoscopist is ready for you, a member of the team will come and take you through to the endoscopy room. They will ask you to confirm your name and date of birth and introduce you to the staff who will be looking after you during your procedure. You will be looked after by one of the nurses or endoscopy assistants who will stay by your side throughout the procedure. There will be a minimum of 3 members of staff in the room, but there could be more. There may be a medical student or nursing student attending, and some procedures may be carried out by a trainee, but only with your permission. This is the equipment the endoscopist uses. The endoscope is a tiny camera attached to a thin tube which allows images to be displayed onto the screen. The nurse will monitor your heart rate and breathing using a small plastic device that is placed on your finger. If you are having sedation, then a small nasal cannula will be placed on your face to allow some oxygen to be administered throughout. The endoscopist and nurse will guide you throughout your procedure. This will vary depending on what procedure you are having, as will the length of time your procedure will take. Following your procedure, you will be taken through to our recovery area. You will be handed over to one of the recovery nurses who will check your blood pressure and comfort levels. The amount of time you spend in recovery will vary depending on sedation use and procedure type. You will be offered something to eat and drink and will be given post-procedure information leaflets, as well as a copy of your procedure report. If you have had sedation, then you will need someone to collect you from the unit, take you home, and stay with you overnight. The endoscopist may wish to speak to you after the procedure, but if not, the nurse will discharge you when you are ready and will go over any information that has been passed on from the endoscopist. And please refer to the discharge booklets for contact information if required. I hope this video has given you an overview of the unit and of what to expect during your visit.